I will switch a little bit from the kind of like the economic perspective or the evidence-based decision-making perspective. Before I start my presentation, I have one question kind of in my mind for a while. I was wondering whether diseases like avian flu, brucellosis are really qualified or regarded as the disease-borne or food-borne diseases. If they are, I check the internet. Some people said yes, some people said no. So it's still kind of confusing. But if they are regarded as food-borne diseases, then I probably don't agree with you about this is a big issue. Pandemic kind of thing will play in. So, but anyway, as the previous speaker mentioned, in this field, especially in this region, we are kind of lack of data and evidence. So that's why I starting from the kind of, this perspective. Even by a conservative estimate, the food-borne diseases still poses about $78 billion in the United States annually. But I look at the literature, there are very few studies have been done in the developing countries, unfortunately. And if we think about compared to the United States, in developing countries, where the problem of food-borne diseases is far greater, the effect on the individuals and the society can only be far more severe. So the use of evidence is critical in guiding the decision-making. Evidence-based decision-making produces more effective policy decision, and as a result, much better outcomes for the individuals and the society. So before I joined the China Agricultural University 2 years ago, I worked at the US CDC, Centers for Disease Control and Prevention, for 8 years. So we have kind of the concept for the called the evidence-based decision-making. So what's the definition? So the definition is really evidence-based decision-making is a process for making decision about a program, a practice, or a policy that is grounded in the best available research evidence, but informed by experiential evidence from the field and the relevant contextual evidence. So the idea is not just research evidence. You have 3 types of evidence play in: research evidence, experiential evidence, and contextual evidence. So let me go back to the first research evidence. I try to think about, whether we really understand the impact of the food-borne diseases. What's the evidence there? How much is there, especially in the developing countries? Given, as Professor Sang just mentioned, food-borne diseases can appear in any part of the whole process from farm to mouth. So it's a much more complicated issue in some way compared to the cancer or maybe some other diseases. So what's the impact? Do we really have good understanding of it? Maybe we can think about several things. For example, what's the impact on healthcare? What's the loss of the income by the affected individual? The impact on the productivity loss due to the absenteeism, cost of the investigation of the outbreak, and the cost of the response to the outbreak, and also maybe the loss of income due to the closure of business, and the loss of sales when consumers avoid particular products. How about the reduced consumer confidence, and so on. So, and another thing I was thinking, even we understand more about the impact, still we need in some way to link the impact to something the policymaker can really understand. So I give an example. When I was in the CDC, child abuse is a problem. It's a severe problem in the United States. But they think it's severe, but never really appreciated that much as the other high-profile public health problems. So we did the economic or estimation of the burden of child abuse. So what we got is actually a lifetime burden of a new case of non-fatal child maltreatment is about $210,000 per victim. But we didn't stop there. We link this, we compare this to the economic burden of a stroke, type 2 diabetes per case. Actually is comparable or even larger than those two very high profile public health problems. So that kind of gave the public and the policymaker quite a good idea. They think, oh, if something happened to the children, say abuse, it's just like somebody got, type 2 diabetes or stroke. So that way, I think after we got this estimation published, we got kind of strike the public. So the CNN even had a live interview on it. Then, besides the impact, we also kind of need evidence on the effectiveness of the alternative strategies, policies, or activities, or programs. So do we really have enough evidence on the, the effectiveness? What kinds of strategies or activities or policies are effective? And also we won't just stop there. We also need to go further to think about the institutional or program cost of all the choices. So the idea is you not only need to think about the effectiveness, but you also need to think about the cost. So the idea is cost effective. So for example, I think a good example, I think the other day, a speaker already mentioned about the Xiangming equation. So the Nobel Prize winner, Professor Xiangming, he kind of estimate the return on the early quality education for children. So the idea here is basically he estimates every dollar invested in quality early child development for disadvantaged children produce a 7% to 10% return per child per year. So that's quite kind of strong argument for investment on that. So the idea is we are talking with not just researchers, we are talking with the policymaker and other stakeholders. So we need evidence for sure, but at the same time, we need to know how to communicate with them. And in addition to the research evidence, we also need to have a good understanding on the contextual evidence. So where the strategy or the policy really fit the location or the population affected by the decision, we need to have a very good understanding on the contextual evidence. And also, we need to draw on the experience and expertise of the policymaker and other stakeholders, even practitioners. So the idea is we needed to understand the experience, prevalence, and the values of all the stakeholders. In that way, we can combine our goal with their goals. So what I was trying to say, to really do evidence-based decision making, you need three types of evidence. I know, but I didn't really mean we shouldn't react, we shouldn't do anything without accumulate all this evidence. It's kind of by learning, by doing kind of experience. But we always need to keep in our mind, evidence, get more and better evidence to support the future decision making. And then, with the evidence, we still need to think about how the policymaker can best use the evidence. So according to our experience in China, I think in some time, try your best to conduct some trainings for the policymaker is a good way. So we sponsored by the World Bank. We conducted 2 training workshops in terms of impact evaluation for the policymakers. Actually, surprisingly, they were quite keen in learning this methodology. And also, at the end, finally, actually, they use a lot in their future plannings and even policy making. I was a little surprised 1 year from now, change. My time is kind of off then, but to summarize, I really think evidence-based decision making is key to build an effective resilience system for foodborne diseases. Thank you.